everyone and welcome to today's session on healthcare services in the bottom of the pyramid market. In our previous sessions, we have explored a range of topics that are crucial to understanding the dynamics of the BOP market. This have included the characteristics of the BOP, product and branding strategies, pricing, distribution, promotion and the role of information and communication technology in reaching underserved populations. Additionally, we have discussed services such as financial products and telecommunications offerings specifically designed to meet the needs of the BOP market. Today, we will shift our focus to one of the most vital sector for improving the quality of life for individuals at the BOP, which is known as healthcare services. Access to healthcare is a fundamental aspect of human well-being, and for the BOP, it is a major challenge. In many developing countries like India, Sub-Saharan Africa and Southeast Asia, quality healthcare remains out of reach for large sections of the population. The lack of adequate healthcare infrastructure combined with economic constraints poses a significant barrier to health improvement in these regions. In this session, we will not only discuss the unique challenges faced by the BOP in accessing healthcare, but we will also delve into innovative solutions that are emerging to address these challenges. We will look at how organizations, both from public and private sectors, are utilizing creative strategies to bring healthcare to the BOP market. These strategies often include leveraging technology, community-based solutions and partnership between social enterprises, government and internal organizations. Throughout the session, we will examine several real-world examples where companies have successfully developed healthcare models for the BOP market. These examples will highlight key areas such as mobile health clinics, telemedicine services, affordable healthcare products and low-cost healthcare delivery models. By the end of this session, you will gain a comprehensive understanding of the healthcare challenges at the BOP and the potential for innovative solutions to bridge the healthcare gap. So, let us begin by first examining some of the critical barriers that the BOP faces in accessing healthcare services and how these challenges differ from those in more developed markets. We will then explore the innovative approaches that are making a tangible difference in improving health outcomes for people at the bottom of the pyramid. So, before diving into the specifics, let us briefly revisit the BOP demographic. The bottom of the pyramid refers to the population segment that lives on less than $2 a day. According to estimates, around 3 billion people globally belong to this group, and while they represent a huge consumer base, they also face significant barriers when it comes to accessing essential services including healthcare. For instance, in India, more than 60% of healthcare expenditure comes from out-of-pocket spending. The underserved rural and low-income urban communities often lack access to basic medical facilities, doctors or even affordable medicines. Yet, despite these challenges, the BOP healthcare market presents huge opportunities for businesses and innovators who can provide affordable and accessible solutions. Let us now examine the challenges that make healthcare delivery to the BOP very complex. Challenges which are there in healthcare, the first one is limited access to healthcare services. In many parts of the world, especially in rural areas, healthcare infrastructure is extremely limited. There are not enough hospitals, clinics or qualified healthcare professionals. Even when healthcare services are available, They are often located far away from where BOP communities live, making it a logistical nightmare for people to access them. For example, in India, there are vast rural regions where residents have to travel for hours just to access basic healthcare services. According to a study by the World Bank, nearly 65% of the rural population in India lives more than 5 kilometers away from the nearest healthcare center. The second challenge, financial constraints. Health insurance penetration in BOP segments is extremely low, and out of pocket spending on healthcare is a major burden for families living below the poverty line. For many individuals in these communities, spending even a small amount on healthcare services is a choice between their survival or the treatment. In India, health expenditures are responsible for pushing nearly 39 million people into poverty each year. This situation exacerbates the cycle of poverty and the poor health. The third challenge, lack of health literacy. Many individuals in the BOP segment lack the necessary health literacy to understand how to prevent and treat common illnesses. Misunderstandings about disease prevention, self medication, and reliance on traditional medicine are common in these communities, which further complicates healthcare delivery for them. The fourth challenge, inadequate infrastructure. The absence of basic medical infrastructure such as well-equipped clinic, medical supplies and trained healthcare professionals makes it difficult to provide timely and effective healthcare services in BOP regions. Additionally, issues like poor sanitation and malnutrition also increase the demand for healthcare services. Innovative solutions for healthcare at the BOP. Given these challenges, there are several innovative solutions which are emerging that are aiming to make healthcare services more accessible, affordable and effective for the BOP segment. So, let us explore some of these approaches or the solutions. The first, mHealth, mobile health solutions. Mobile health technologies are playing a crucial role in bridging the healthcare gap at the BOP. Through mobile phones, healthcare providers can offer services such as consultations, reminders for medication and health education. Let's see one case of Operation Asha. Operation Asha is one of the most innovative example of mHealth in India. The organization provides tuberculosis treatment directly to patients through strategically placed kiosks in communities. These kiosks are manned by trained local staff who ensure that patients take their medication on time. The model uses mobile phones to track treatment adherence and send reminders to patients. In Kenya, mobile health platforms have transformed healthcare access by allowing users to consult doctors remotely, order medication, and even receive diagnostic services through their mobile phones. Services like M-TIBA, a mobile health wallet, allow people to pay for healthcare services via mobile money, improving affordability and accessibility. The second solution can be cross-subsidization models. Another approach to making healthcare accessible is the cross-subsidization model, where companies or organizations offer affordable services to the BOP by balancing the cost with higher margin services for more affluent segments. For example, the Indian healthcare chain Arvind Eye Care operates on cross-subsidization model, offering free eye surgeries to low-income patients while charging higher fees to wealthier patients. This model allows them to sustain a high volume of low-cost surgeries without compromising on the quality of care. The third solution, community health workers. One of the most promising solutions to healthcare delivery in underserved areas is deployment of community health workers. These individuals are local residents who receive basic medical training and provide healthcare services within their own communities. By doing so, community health workers not only ensure that healthcare reaches remote areas but also reduce the burden on the formal healthcare system. The community health worker model in Bangladesh is an excellent example of how local workers can make a difference. Bangladesh has trained thousands of community health workers to deliver maternal and child health services. These workers provide essential services like immunization, prenatal care, and basic treatment for common ailments. The fourth solution is public-private partnership. Public-private partnerships are increasingly being seen as a viable way to address healthcare challenges at the BOP. By combining government efforts with the private sector innovation, these partnerships can bring about sustainable and scalable solutions for healthcare delivery. For example, in Rwanda, the government has partnered with private entities to build a robust health insurance system that covers a large portion of the population. The country has achieved 92% health insurance coverage with premiums costing as little as $2 per year, ensuring that even the poorest families can afford health care. Now let's see global perspective on BOP healthcare. Rwanda's health insurance model is a success in universal healthcare coverage is a model for other developing countries. With a highly affordable insurance model, Rwanda has been able to achieve near universal health insurance coverage, even in their rural areas. Let's see what are the healthcare challenges in India. India faces a significant challenge in providing healthcare to its BOP segment. With a low number of healthcare workers per capita and a disproportionate focus on urban healthcare services, India must focus on innovative models such as telemedicine, M-Health and PPPs to reach its vast rural population. Let's see, for example, China's village doctor program. In China, the government has implemented a village doctor program, training local farmers to become village doctors who can deliver basic healthcare services to their communities. This model has been highly successful in providing primary healthcare in remote rural areas. So, looking at all these examples, we can conclude saying healthcare at the bottom of the pyramid presents a unique set of challenges, but also incredible opportunities for innovation. Through mobile technology, community health workers, cross-subsidization models and public-private partnerships, we are witnessing transformative changes in how healthcare services are delivered to underserved populations. These innovative solutions are not only making healthcare more accessible, but also more affordable, thus improving the quality of life for millions of people at the BOP. Moreover, as we explore these solutions, we see that the future of healthcare in these communities is centered on empowerment. Empowering individuals with the tools, resources and knowledge to take charge of their health. Collaborative efforts between governments, non-government organizations and the private sector plays a pivotal role in scaling these innovations and ensuring that no one is left behind. By continuing to push the boundaries of what is possible and leveraging technology in creative ways, we can create healthcare systems that are not just inclusive but sustainable. These efforts have the potential to not only address immediate health needs, but also create a foundation for long-term wellness in underserved populations. So that's all for today's session. Thank you for joining this class. I hope you have gained valuable insights into how healthcare services can be made more accessible and more impactful for the underserved. If you have any question or if you would like to discuss further, please feel free to reach out through discussion forum. So that's all for today. Thank you.